listening to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. It is a podcast as well. Jeannie Roller is my co-host. Jeannie, we are going to do a second podcast, a continuation of one that we did a little while ago about medical procedures, what should happen when you're having a medical procedure to avoid and avert, whatever adjective you want to or verb you want to use, the sexual abuse. And what sexual abuse can happen when these procedures aren't followed specifically to respect and dignify the person, the patient that's in that certain procedure. So you've got some statistics too and some data, which is always disturbing when this stuff happens.
Yeah.
Always, especially when the numbers start climbing in the bad way, in the bad view.
Yeah. Well, this is a 2022 report published by the National Library of Medicine, and the study range was 2003 to 2013. And I realize a lot has happened since then, but these studies are always so far behind.
Right.
But they reported at that time at least 1,039 physicians had at least one sexual misconduct report filed against them with the National Practitioner Data Bank. Now, I wanted to expand on that, Cindy, that there is something for doctors. But a lot of times we're seeing nurses do it.
Techs.
A lot of male nurses. Yeah.
And techs and all those kind of things.
Yeah. So, I mean, both anyone in a medical setting, MAs, doctors, nurses, X-ray techs, there should be a tracking system for all of that.
And we've talked about that. And the techs are, a lot of them in a lot of states, and I don't have the specifics right now in front of me. They're certainly not licensed. They aren't licensed, and a lot of them are trained on the job, if you will. And it's not their only job, and it's very disturbing to hear some of the ins and outs of how they actually get to be techs, and they're in the room with people that are naked and compromised and that really aren't trained very well, if they're trained at all.
Yeah. And there's analysis of 101 cases of physician sexual abuse. 89% of the victims were female, which means 11% were male, and 60% were adults, meaning 40% were non-adults, children.
Yeah.
So, I mean, that's kind of shocking.
Yeah.
That's really, really disturbing.
Yeah.
Yeah.
Especially disturbing, I want to say. Especially, I mean, no one wants it to happen to an adult, but in an adult, you're in the business of, life or whatever. You've had some life. These children do not know.
Yeah. And sadly, 39% of the cases occurred in family medicine or pediatrics. 39%, Cindy. And followed by mental health practices, 16%. And that's both of those are together are, just really disturbing because they prey upon weakened conditions. So internal medicine was almost 15%, and then OBGYN was 13%. And those are actually the ones that we hear about more, which is, kind of surprising, but that's the ones that we hear about more.
You mean the OBGYN?
And they say that, that 85% of the physicians who committed the abuse examined patients without a chaperone. Okay. But we also know that the abuse can happen with a chaperone present.
Their chaperone, not your chaperone.
72% of the physicians involved lacked, their chaperone, lacked board certification.
Yeah.
That's amazing, because I always look for that to see what they are licensed for, specialize in. But, and if that's not displayed, then that's like a red flag for me.
Yeah. So why should people look for that, Jeannie, real quick? Why should people, real quick, why should people think that that's the Optimum Care board certified?
Well, because you don't want a foot doctor doing a pelvic exam.
Okay.
Do you?
Well, I mean, I'm asking you because people wouldn't necessarily know.
Yeah.
Okay.
Yeah. A heart doctor generally wouldn't need to do a pelvic exam or a breast exam for that matter.
Okay. All right.
So there's been cases I've read they have, and it was sexual abuse.
Okay, so board certified in their specialty.
Most of the sexual predators are male. Yeah. But most of the sexual predators are male, and they're usually over the age of 39.
Okay.
So there is 8% that are female out there that are sexual predators as far as physicians.
Mm-hmm.
And that between 1999 and 2016, more than 31 physicians were named as sexual misconduct reports to state medical boards. Now, I don't know the number of physicians licensed in the U.S., but I bet it's a whole lot more than 3,100. So, I mean, there's just a very small amount that are getting reported. But then on the flip side, Cindy, they have a lot of cases or a lot of victims, I guess. Victims is the word I was looking for. So
you're saying those 3,100 doctors...
It just is amazing.
Yeah, the 3,100 doctors have a lot of people that they have abused.
Right. And, this is a 17-year period.
Right.
But when you think of only 5% of cases get reported, then it's like, oh, in your mind, that number can grow substantially because not that many are getting reported. But the ones getting reported generally have more than one victim.
Right.
So
yeah,
the victim count grows high. So it said in 2003 to 2013, at least physicians had at least one sexual misconduct report filed, which again, it doesn't seem as that many. But then when you think again on that small percentage getting reported, you know that there's a lot more out there.
Well,
I just don't know how many.
There shouldn't be one in that profession. There should never even be one. Right. I don't care what kind of doctor it is. It shouldn't be.
Yeah.
So it's a lot. Yeah. I mean, anything above 0 is a lot, in my opinion. But right. People are people. I guess they start out as people, and at the end of the day, if you don't have the right foundation, I mean, psychiatrists have to be psychoanalyzed.
Right.
So their own should be policing their own.
And we talked about this in our prior podcast, that it's hard to report because there is no mechanism in place. Mm-hmm. So, and this, Cindy, when you go to the patient advocates, the hospital patient advocates, you get pushed around, you get told it didn't happen, right. all kinds of things. If you go to the police to make a report, a lot of times they don't take it seriously.
Yeah.
So they'll say it's a civil case, it's criminal.
Yeah, I want to say the ones that I've talked with, now this is in Florida, that's all I know. I don't know the other 49 states. The ones that I've talked with here locally, people that have reported it, in all honesty, the police stepped up and they were appalled that they even had to investigate something like this. They were like us. These people in the medical community should be above reproach across the board.
Right.
So, yeah, I mean, that's what I know about the people that I've talked with here in Florida, that the one guy that comes to mind right now, he was abused by, it was a teacher and a coach when he was in sports. And he didn't get the way we've talked about this podcast. The Florida came up with a law, and it's evading me right now, that going forward, when that law went into effect, I think it was like 2 years ago, this cannot happen, blah, 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 blah. Here are the things. His didn't, but his satisfaction was now, in his mind, this isn't going to happen to somebody else. And that's all we're looking for. It already happened to us. Mm-hmm. It already happened to us. So our solution for ourselves, for the PTSD and everything else real quickly, is to help other people, because it already happened to us and that we went through all of the trauma of everybody telling us it didn't happen and you're a bunch of jerks and blah, 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 and worse stuff. And worse stuff. There was nobody that listened to us. On that note, stay listening to Evergreen Media Network.